Hallo.
After unpacking the device and connecting it to power, and connecting the computer to the internet, we will now briefly demonstrate the simple application and execution of Cavitao scans in the next 10 steps. By turning on the all-in-one PC, the software performs a brief self-check and automatically opens the user interface of the Cavitao software. If the software detects any errors during the self-check, you will be notified through the status window. In this case, for safety reasons, measurements cannot be performed. However, the viewer function to visualize previously conducted and saved scans is still available.
Ist in jedem Fall allerdings möglich.
This simple test is performed at the beginning of each workday to ensure that all sensor elements are functional and the device can provide reliable results. To do this, attach the Cavitao distance meter to the movable transmitter arm with a small tilting motion, applying minimal pressure. Prepare a glass of still water that is wide and deep enough to easily accommodate the handheld unit without contacting the vessel. With the device turned on, bring the transmitter and receiver close enough together so that the Cavitao distance meter rests against the receiver arm.
So weit aneinander, dass der Cavitao Abstandsmesser am Empfängerarm anliegt. Führen Sie nun in dieser
Slowly insert the handheld unit into the water-filled glass, following the same procedure, and observe the screen as the ultrasound wave coupling stabilizes. In the column chart, after a few moments, all columns should be of equal height.
Alle sollen gleich hoch sein. In der vereinfachten linken Darstellung,
in the simplified left display, all fields should show blue watermark, while the right display, all fields should now be gold. Such a result indicates that the handheld unit is functioning properly, and you can proceed with your measurements.
Und Sie mit Ihren Messungen beginnen können. Sollten allerdings
However, if you notice any deviations in individual columns or elements, please contact Cavitao customer service for assistance.
Holen Sie das extraorale
Retrieve the extraoral gel cushion from its packaging and carefully insert the transmitter's ultrasound probe into the designated slot on the shorter side of the cushion.
Seite des Kissens. Achten Sie hierbei sorgfältig darauf.
Pay close attention to ensure that there are no air bubbles on the inner side of the cushion, which will be in contact with the patient's cheek during the measurement. Keep the packaging, as you can reuse this cushion after thorough and moist disinfection.
Gründlicher und feuchter Wischdesinfektion wiederverwenden können. Sollten also zwischen den
If there are several hours between measurements, please store the cushion in its original packaging to keep it airtight. When used correctly, the extraoral cushions can be used for approximately 10 to 15 patients.
Die extraoralen Kissen für bis zu ca. 10 bis 15 Patienten verwenden. Durch das Anklicken des Buttons
By clicking the Patients and Scans button, the patient management window will open. Here, you will find an alphabetical overview of all previously saved patient data. Clicking on a patient already registered in the system will display their name, date of birth, patient number, imported OPGs, orthopantomograms, and previously conducted Cavitao scans. By simply clicking on Add New Patient, you can create a new patient file. Just enter the patient's name, date of birth, and optionally the patient number.
Und gegebenenfalls die Patientennummer ein. Anschließend importieren Sie über den Button.
Next, use the Import OPG button to import a current panoramic image of the patient in JPEG format. This is a necessary requirement for using Cavitao and can be done either through your practice network or using a USB stick.
Bevor Sie mit der Messung nun beginnen können,
Before you can begin the measurement, there is one important detail missing, which is the inaural gel cushion. Each cushion can only be used for one measurement and is assigned a serial number. Without this number, a measurement cannot be performed. Click on the Start New Scan button and enter the 6-digit number printed on the packaging of the gel cushion in the designated window. The user interface for starting the measurement will open.
Nun öffnet sich die Benutzeroberfläche für den Beginn der Messung. Holen Sie das enorale Gelkissen.
Retrieve the regular cushion from its packaging.
und führen Sie den Sensor behutsam in das Sleeve
and gently insert the sensor into the sleeve and centrally into the cushion. Pay careful attention to ensure that there are no air bubbles on the inner side of the cushion, which will be in contact with the patient's jawbone during the measurement.
Nun können wir
Now we can start the scans on the patient.
Positionieren Sie den Patienten so,
Position the patient in a comfortable lying position. The more relaxed the patient is, the more relaxed their jaw muscles will be, which will make the measurement more pleasant for both the patient and the examiner. Position the screen at approximately a 45-degree angle behind the patient's head so that you can look at the screen during the measurement, while also keeping an eye on the patient's head.
und gleichzeitig den Kopf des Patienten im Blick haben. Positionieren Sie das Fußteil so,
Position the footrest so that you can comfortably operate it with one foot. Similar to driving a car, your foot should remain on the footrest pedal throughout the measurement process. Hold the handheld unit comfortably with both hands. One hand takes control while the other stabilizes it. As with any sonography procedure, additional gel is required for the coupling of the ultrasound waves. At the beginning of each measurement, make sure to have a bottle of the special ultrasound gel on hand. We recommend obtaining a special, skin-friendly aloe vera gel, which is also available in the Cavitao online shop. It is also advisable to have paper towels readily available. Using the OPG X-ray image as a guide, get an overview of the existing dental situation in the patient's jaw area.
relevante Bereiche, die mit Hilfe des Cavitao Ultraschallgeräts
The following 5 areas should be measured using the Cavitao ultrasound device. 1. Regions where teeth have been extracted, including edentulous areas and the dental areas of 9. 2. Root-filled teeth. 3. Implants. 4. Regions where suspected inflammation foci may exist. 5. In addition to each area, at least one reference tooth.
Wichtiger Bestandteil einer verlässlichen Cavitao-Diagnostik ist die Messung von Referenzzähnen.
Measurement of reference teeth is an essential part of reliable Cavitao diagnostics. They provide comparative values for assessing individual bone quality. Depending on the patient's dentition, at least one healthy neighboring tooth or the nearest healthy tooth to the examined area serves as a reference point.
Gesunde Zahn als Referenzpunkt. Wählen Sie am Bildschirm
On the screen, select the desired odonton, tooth or area for examination by clicking on it. The blue frame indicates the selected area. During the measurement process, you can navigate between odontons using the left and right switches on the footrest. To orient yourself during the measurement, use the right navigation window, which displays different structures in different colors. Ideally, start with the mandible, lower jaw, and then continue with scans in the maxilla, upper jaw.
Und setzen Sie anschließend Ihre Scans im Oberkiefer fort. Legen Sie den enoralen Sensor flächig.
Place the enaural sensor flat against the inner side of the jawbone, apical to the tooth you want to measure. Gently guide the sensor towards the floor of the mouth, and gently press the extraoral sensor against the cheek.
Klappen Sie mit sanftem Druck den extraoralen Sensor an die Wange. Warten Sie einen Moment.
Wait a moment for the ultrasound waves to stabilize, then capture an image using the middle switch on the footrest.
Schalters des Fußteiles eine Aufnahme aus. Bewegen Sie nun schrittweise das Handstück.
Gradually move the handheld unit along the tooth axis from apical to coronal. Ensure that the transmitter and receiver are always in full contact to ensure the necessary coupling of the ultrasound waves.
Der Ultraschallwellen zu gewährleisten. Machen Sie pro Odonton
Take multiple images per odonton to document the entire measurement process.
Legen Sie den enoralen Sensor flächig palatinal.
Place the enaural sensor flat palatally at the transition between the tooth under examination and the palate, and gently press the extraoral transmitter against the cheek.
An die Wange. Warten Sie einen kurzen Moment.
Wait for a brief moment until the ultrasound waves stabilize. Then capture an image. Gradually move the transmitter along the tooth axis from apical to coronal.
Entlang der Zahnachse. Von apikal nach koronal. Die Position des Empfängers.
The position of the receiver serves as the pivot point for the slight rotational movement. Ensure that the transmitter and receiver are in full contact to ensure the necessary coupling of the ultrasound waves. Take multiple images per odonton to document the entire measurement process.
Nach Messung des ersten Areals, also der Referenzzähne und des relevanten Bereiches,
After measuring the first area, which includes the reference teeth and the relevant region, it is necessary to verify if the preset threshold value of the device is suitable for the patient's anatomical bone structure. By default, the threshold slider is set to the middle position. This setting is suitable for approximately 75% of people.
vergleichen Sie
To
hierfür
determine this, compare the red-green representation with the black-blue representation.
passt die Fläche.
If the overall color distribution of the sensor elements in the left display matches that of on the right navigation window, then the threshold slider can remain in the middle position.
Kann der Threshold-Regler in der Mitte bleiben. Lediglich bei Abweichung
Only if there are discrepancies between these representations, the slider should be adjusted either up or down.
nach unten verschoben werden. Dies führt zu einer Angleichung.
This adjustment aims to align the patient window display with the navigation window display. Once you have scanned all areas and have taken multiple images per odonton, you will need to select the most representative image for each area.
Noch jeweils die aussagekräftigste Aufnahme auswählen. Die Aufnahmen werden an der
The images will be displayed on the right side of the screen, in the order they were captured, arranged vertically.
gebildet. Durch Anklicken
By clicking on an image, a blue frame appears around it.
diese Abbildung.
At the same time, this image is displayed in the overview of the odontones at the bottom of the screen.
Im unteren Bereich des Bildschirms angezeigt. Die aussagekräftigste Aufnahme bildet
The informative image does not depict the jaw cavity or the inferior alveolar nerve. It shows the middle region of the jawbone with either a consistently dense bone structure or, in the case of pathology, a softened structure surrounded by dense bone.
dem Knochen. Gratulation zu Ihrem ersten erfolgreich durchgeführten Cavitao-Scan.
Congratulations on successfully performing your first Cavitao scan. Now that you have performed and selected your first scans, the next step is the correct interpretation of the results. In other words, the actual diagnosis by the dentist. To learn how to properly interpret and diagnose the Cavitao scans, please refer to our Cavitao tutorial.
Cavitao Tutorial Part 3.